Waking up multiple times to pee after 50 isn't just frustrating. It could be a silent warning from your body. Left unchecked, it might steal your energy, disrupt your sleep, and mask something deeper. But there are natural ways to calm your bladder, and what you're about to learn could change everything. Let me ask you something personal. How many times did you get up last night to use the bathroom? 1? 2? More than that? If you're over 50, this may feel like just another part of getting older, a minor annoyance, something everyone eventually goes through. But what if I told you that this seemingly harmless habit could be a silent signal from your body, a kind of whisper before the storm, a signal that something deeper is shifting in your internal balance? And the truth is, many people never stop to question it. They think it's normal. They live with it. They lose sleep. They lose energy. They lose concentration. They accept fatigue and mental fog as part of the aging process. But what if much of this could be reversed or even prevented? As we age, our bodies naturally undergo changes. That part is true. Hormones shift. Muscle tone declines. The bladder becomes more sensitive. The prostate, in men, often begins to enlarge. And in women, pelvic floor muscles weaken. These are natural progressions. But natural doesn't mean untreatable. And it certainly doesn't mean we have to live with the consequences in silence. Frequent urination after 50 isn't just a bathroom issue. It can be a sleep issue, a cognitive issue, even a cardiovascular issue. Interrupted sleep, night after night, throws off your body's repair cycle. It elevates stress hormones like cortisol. It disrupts memory consolidation. It causes fluctuations in blood sugar and blood pressure. And over time, it steals away one of your most vital foundations of good health, quality rest. And yet, so many continue to downplay it. They joke about it. They shrug. Or worse, they reach for over-the-counter solutions without fully understanding the cause. But what if there were natural methods, effective, scientifically supported, and simple, that could not only reduce nighttime trips to the bathroom, but also restore your sense of calm, increase your daily energy, and improve your overall health? What if you could regain your full night's sleep without relying on chemicals or suppressive medications? That's exactly what we're going to explore here. But first, I want you to stay with me until the very end, because I'll be sharing a bonus tip, one that most people never hear about. It's a natural compound that you probably already have in your kitchen right now, and when used the right way, it can dramatically amplify the effectiveness of everything we're going to discuss. But before we get there, let's understand the root of the issue. As you age, your kidneys begin to filter blood at a slightly different rate. Your bladder loses a bit of elasticity, so it feels full sooner, even when it isn't. The nerves that tell your brain it's time to go become more sensitive. For some, it's the result of an enlarged prostate. For others, it's a change in hydration patterns, certain foods, or even how they manage stress. Here's something few people talk about: chronic, low-grade inflammation, the kind triggered by years of unhealthy habits, can silently irritate the bladder lining. And that irritation increases urgency, frequency, and discomfort, even in the absence of infection. But here's the good news. You can influence all of these factors through natural adjustments. You can support your urinary health, reduce inflammation, strengthen your bladder, and regain control. And here's something else to consider. Frequent urination isn't always a standalone issue. It can be the first sign of insulin resistance. Or it could be linked to imbalanced adrenal function, especially in people dealing with chronic stress. Ignoring it may allow deeper imbalances to go unaddressed, but acknowledging it opens the door to prevention. This isn't about scaring you. It's about empowering you. Small, intentional changes can yield powerful results. And what you'll learn today is not just how to ease the symptom, but how to improve your entire system using the kind of knowledge that fuels real transformation. And it all starts by understanding what you might be doing every single day that's quietly making things worse, even if it seems totally harmless. Because the next thing we need to talk about is something you're probably consuming without even thinking twice. And it might be irritating your bladder more than helping your body. And here's the thing. Ignoring what comes next won't just slow your results. It might actually make your symptoms worse over time. So, if you're serious about improving your urinary health and regaining restful sleep, you won't want to miss it. If you're like most people in North America, there's a good chance you started your morning with a hot cup of coffee. Maybe two, maybe more. It feels comforting. It gives you energy. It's part of your routine. But what if I told you that something as ordinary as your daily cup of coffee could be contributing to your nighttime bathroom visits? And it's not just coffee. It's what we eat, what we drink, and how we snack that often makes the situation worse, without us even realizing. Let's start with the basics. Caffeine is a diuretic. That means it tells your kidneys to release more water, which leads to more frequent urination. That extra pressure on your bladder isn't just inconvenient. It can disrupt your entire rhythm of rest and recovery. Now, if you're drinking caffeine late in the day, even as early as mid-afternoon, it could still be affecting your sleep and bladder function long into the night. But caffeine is just the beginning. Many North American diets are filled with what we call bladder irritants. These are foods and drinks that cause your bladder to become more sensitive, more reactive, and more prone to urgency. Think about spicy foods, artificial sweeteners, carbonated drinks, acidic fruits like oranges and tomatoes, and yes, alcohol. Even healthy items like cranberry juice can sometimes backfire if consumed in excess or at the wrong time of day. The timing and combinations of these foods matter more than most people realize. And then there's the hidden sugar. So many of our packaged foods, even ones labeled as healthy, are packed with sugars that increase systemic inflammation. When inflammation rises, the lining of the bladder can become irritated and inflamed as well, triggering the sensation of urgency even when the bladder is only partially full. Here's something that surprises many people. Artificial sweeteners like aspartame or sucralose, commonly found in diet sodas and sugar-free snacks, have been shown to irritate the bladder lining in sensitive individuals. That zero-calorie soda may not be helping your health as much as you think. But before you feel overwhelmed, here's the empowering part. Removing just a few of these irritants from your daily habits can make a noticeable difference. Some people report better sleep and reduced urinary frequency within days of making strategic dietary changes. A good place to start? Eliminate caffeine after 2 p.m. Reduce or avoid carbonated drinks. Limit spicy and acidic foods, especially at dinner. Choose natural sweeteners like stevia in moderation, and prioritize anti-inflammatory whole foods like leafy greens, berries, and omega-3 rich seeds. Instead of that soda with dinner, try chamomile tea or simply filtered water with a slice of cucumber or ginger, both known for their soothing properties. And there's another layer to this: hydration timing. Yes, drinking enough water is essential for urinary health. But drinking too much water late in the day, or chugging large amounts in one sitting, can actually place strain on the kidneys and bladder. Instead, space your hydration throughout the day. Start early, sip consistently, and taper off after dinner. Your bladder will thank you, and your sleep will likely improve. A simple shift in your daily rhythm can lead to profound benefits over time. Less urgency, better rest, sharper focus during the day, and most importantly, a renewed sense of confidence and calm. You see, your body wants to find balance, but it needs your help. So take a look at what you're consuming. Not just the big stuff, but the subtle, daily habits that seem harmless. That flavored yogurt with hidden sugar, that diet soda in the evening, that extra coffee at 4 p.m. Every choice either calms the bladder or agitates it. This isn't about deprivation. It's about education. When you know better, you can do better and feel better. And there's more good news. Certain foods actually soothe the bladder and reduce inflammation. There are natural options that not only stop irritation, but actively promote healing from within. And one of these foods is not only delicious, it's often overlooked in most kitchens. But it only works when used the right way. And the wrong approach could cancel out its benefits completely. That's why what comes next is one of the most important parts of this journey. Because without it, you may not get the full results you're looking for. And worse, you might experience setbacks that are completely avoidable. Once we begin to remove the triggers that irritate the bladder, like caffeine, artificial sweeteners, and acidic foods, we create space for healing to happen. But clearing the way is just the beginning. To truly restore balance and improve urinary health, we need to provide the body with the right fuel, nutrients and compounds that actively soothe, strengthen, and rebuild. And this is where food becomes medicine in the most practical sense. Let's begin with one that often flies under the radar: pumpkin seeds. Rich in zinc, magnesium, and essential fatty acids, pumpkin seeds have been studied for their impact on bladder control, particularly in men with overactive bladders and women dealing with weakened pelvic muscles. These tiny seeds support muscle tone in the bladder wall and reduce the sensation of urgency. Next, consider blueberries. More than just a breakfast topping, blueberries are packed with antioxidants known as anthocyanins. These compounds help fight inflammation at the cellular level, protecting the delicate lining of the bladder from oxidative stress. They also support healthy blood vessels, which in turn help maintain proper nerve signaling in the urinary tract. Leafy greens like kale and spinach are often praised for their fiber and vitamin content, but they also provide magnesium, a mineral many adults are deficient in. Magnesium plays a key role in relaxing the smooth muscles of the bladder and reducing spasms that can cause urgency. Including a generous portion of greens at lunch or dinner is a simple step with profound results. Seeds like flax and chia are high in omega-3 fatty acids, which are known to reduce systemic inflammation. But there's another bonus. They also support hormonal balance, which can be critical for both men and women after 50. Balanced hormones mean better bladder function, more stable energy, and fewer nighttime awakenings. Let's not forget about nettle tea. Often overlooked in favor of trendier health drinks, nettle is a time-tested herbal remedy known for its anti-inflammatory and diuretic properties. But unlike caffeine-heavy options, nettle promotes gentle detoxification and has been shown to support prostate health and urinary regularity. There's a rhythm to all of this. When you choose the right foods, your body responds. Inflammation calms. The bladder regains its composure. Sleep becomes deeper. Energy feels more stable, but timing matters too. Eating certain bladder-soothing foods earlier in the day, when digestion is most active, allows your body to absorb more nutrients. Including magnesium-rich foods in the evening, like a small portion of cooked spinach or a banana, can help relax your nervous system and your bladder at night. And staying consistent with hydration from morning through early evening helps the body regulate without overloading the bladder at bedtime. What we eat sends a message. Every bite can either signal irritation or support. And when we listen to the body's signals, we can adapt our habits in ways that prevent discomfort before it begins. It's not about following a strict diet or eliminating everything you enjoy. It's about making smarter choices more often. Swapping soda for herbal tea. Choosing real fruit instead of processed snacks. Adding seeds and greens to your meals. Each small shift adds up. Many people notice improvements in just a few weeks. Fewer bathroom interruptions, more refreshing sleep, and an overall sense of lightness that comes from reducing inflammation and restoring internal balance. And as your bladder calms, your entire nervous system begins to benefit. There's less stress, less tension, and more ease in your daily rhythm. But here's an important reminder. If you introduce these healing foods but continue a pattern that silently undermines your efforts, you may not see the progress you deserve. And unfortunately, one of the most common and well-intentioned habits does exactly that. It's something most people do without thinking, believing it's healthy, even essential. But in the wrong context, it can overload your system and keep you stuck in the cycle of frequent urination and fatigue. That's why the next strategy is not just a suggestion, it's critical, because overlooking it can lead to unnecessary strain, slower healing, and diminished results, even when everything else seems right. There's a common piece of advice you've probably heard your entire life: drink more water. And it's true. Hydration is essential for kidney function, circulation, detoxification, and of course, urinary health. But what few people realize is that how and when you hydrate matters just as much as the amount you drink. In fact, a well-meaning effort to drink more water can sometimes backfire, causing more harm than help, especially when it comes to frequent urination after 50. Let's take a closer look. When you consume large amounts of water in a short period, particularly late in the day, your kidneys are placed under pressure to process and eliminate that excess. The result? More trips to the bathroom. And if this happens after dinner or right before bed, it disrupts your entire sleep cycle. Not just by waking you up, but by shortening the deep, restorative phases of sleep that are critical for healing, hormone regulation, and memory consolidation. It's not just about how much you drink, it's about pacing and timing. Your body needs steady, gentle hydration throughout the day. It doesn't respond well to extremes. This is especially important as we age. The sensation of thirst becomes less pronounced over time, which means many adults unintentionally underhydrate during the day and then overcompensate at night, leading to bladder overload and poor sleep. So, what's the solution? Start your day with hydration. A glass of water within 30 minutes of waking up signals your kidneys to start working gently, supports digestion, and restores fluid balance lost overnight. Then, keep a bottle with you during the day and take small sips regularly. Don't wait until you're thirsty. If your urine is very dark or has a strong odor, that's your body telling you it's behind on hydration. After 7 p.m., begin tapering off. This doesn't mean you should stop drinking water altogether, but it does mean shifting to lighter intake. A few sips here and there. If you're feeling thirsty late at night, it might be a sign you didn't hydrate enough during the day. Also, avoid drinking large amounts all at once. Gulping down 2 full glasses before or after a workout or right before bed can shock the kidneys. Your body can only absorb so much at a time, and the excess gets flushed, sometimes repeatedly throughout the night. And there's another layer to this: the quality of your hydration. Pure water is vital, but sometimes your body needs more than just H2O. It needs minerals, like magnesium, potassium, and sodium, to maintain fluid balance inside and outside of cells. Without these electrolytes, water doesn't get absorbed effectively, and you may find yourself urinating frequently, despite being hydrated. One simple solution? Add a pinch of unrefined sea salt or a squeeze of lemon to your water once a day. These natural sources contain trace minerals that help improve hydration on a cellular level. You can also include foods rich in electrolytes, like avocados, sweet potatoes, and leafy greens. Hydration is more than a habit. It's a rhythm, one that should align with your body's natural needs and energy cycles. As you start to shift your hydration habits, you may notice you sleep more soundly. You feel less anxious. Your bladder becomes less reactive. And most importantly, your body feels supported rather than overwhelmed. Hydration also affects how your body eliminates toxins, balances blood pressure, and transports nutrients. It is the foundation of almost every function in your body, but only when done right. If you're consuming all the right foods, but overloading your bladder through poor hydration patterns, your progress will always feel limited. That's why learning this balance is so essential. It's not about drinking more water. It's about drinking smarter. But here's something else to consider. Even with the perfect diet and the most balanced hydration, many people still wake up at night. They still feel the urgency. They still struggle. Because there's another factor in play, a natural method that has been used for generations to calm the bladder, reduce inflammation, and improve nighttime urinary function. It's a method that most people never hear about, but when used properly, it has the power to change your nights and your days. And if you skip this next step, you may not only slow your recovery, but risk missing out on one of the most powerful natural tools for urinary balance available today. In every generation, cultures around the world have turned to nature for healing. Before pharmaceutical shelves were lined with pills and powders, people relied on plants, roots, and rituals that had been passed down through families. And many of those time-tested remedies hold truths that science is only now beginning to rediscover. One of those forgotten tools is a group of herbs traditionally used to support urinary function, reduce inflammation, and calm an overactive bladder. These aren't magic potions or obscure ingredients. They're accessible, gentle, and deeply effective when used with intention. Let's begin with one of the most powerful, horsetail. Known in botanical circles as Equisetum arvens, Horsetail has been used for centuries as a natural diuretic and bladder tonic, but its magic lies in more than just helping with flow. It's rich in silica, a mineral that strengthens connective tissue, including the tissue in the bladder wall. Over time, this support can help improve bladder tone and reduce urgency. Another key player is corn silk. Yes, the silky threads you often throw away when shucking corn. When steeped into a tea, corn silk acts as a soothing agent for the urinary tract. It eases inflammation and irritation, and it helps the body release excess fluids in a controlled way. That makes it ideal for people struggling with nighttime urgency or low-grade bladder discomfort. Then there's dandelion root. While many see it as a common weed, it has long been revered in herbal traditions for its liver-supportive and mild diuretic effects. The liver and kidneys work closely together, and when both are supported, the entire elimination system benefits. A gentle dandelion tea after lunch or early evening can help flush excess fluids without causing late-night trips to the bathroom. These aren't just old wives' tales. Recent studies have begun validating what tradition has known all along. These herbs, when used correctly, can support urinary function, reduce inflammation, and calm the nervous system. Now here's where it gets practical. If you want to use these herbs effectively, the method of preparation matters. A simple infusion works best. Take 1 teaspoon of dried herb, like horsetail, corn silk, or dandelion root, pour over 1 cup of hot water, cover, and let it steep for 10 to 15 minutes. Strain and sip slowly. Doing this once or twice a day, consistently, can produce noticeable results within a couple of weeks. But consistency is key. These aren't instant solutions. They work gradually, helping your body restore its own natural rhythm. If you prefer, you can also find these herbs blended into high-quality, organic herbal teas designed specifically for urinary health. Just be sure to check that they don't contain added sugars, artificial flavors, or caffeine, which would completely cancel out their calming effects. There's also a ritual element that matters here. Taking a moment each day to prepare a healing tea isn't just about the herbs. It's about signaling to your body that it's safe, supported, and ready to heal. That moment of stillness, the warm cup in your hands, the quiet time to reflect, it all contributes to a more balanced, calmer nervous system. And that alone can reduce urgency. You might be wondering, how do these natural methods compare to medications? It's a fair question. Pharmaceutical options often target symptoms directly, suppressing them. But natural methods work by supporting the underlying systems, the bladder, the kidneys, the liver, and the nerves that regulate them all. And with fewer side effects, greater accessibility, and long-term benefits, natural approaches often provide more than just relief. They offer restoration. If you're consistent with these teas, mindful of your diet, and attentive to your hydration, you're likely to experience fewer interruptions, better sleep, and a greater sense of overall calm. But there's still one final piece missing. Because even with all this knowledge, some people still struggle. They make all the right changes, yet see only minimal results. Why? Because they're missing the real meaning behind frequent urination after 50, what it actually signals, what it can evolve into, and the hidden opportunity it offers when addressed the right way. And the final step includes a natural combination that not only addresses the symptom, but helps reverse the deeper imbalance behind it. Ignoring what comes next won't just limit your success. It could also lead to side effects you never saw coming, especially if you continue to rely on incomplete solutions. It all leads to this. All the changes you've been making, the foods you've swapped, the habits you've restructured, the herbs you've introduced, they're preparing your body for something deeper, understanding the real message behind frequent urination after 50. Because what seems like a simple inconvenience is often your body's way of whispering that something more important is shifting beneath the surface. Let's connect the dots. Frequent urination can be a symptom of imbalances that go beyond the bladder. It may indicate early-stage insulin resistance, a condition where your cells become less responsive to insulin, causing your body to work overtime managing blood sugar. This leads to more glucose in your bloodstream, and in response, your kidneys work harder to flush it out, pulling water with it and increasing urination. It may also reflect adrenal fatigue, a state of overworked adrenal glands from chronic stress, poor sleep, or blood sugar swings. This affects cortisol levels, disrupts electrolyte balance, and increases the need to urinate, especially at night. And in more advanced cases, frequent urination could be a signal of mild kidney dysfunction or early decline in renal filtration. These are conditions that often go unnoticed for years until more serious symptoms emerge. But here's the empowering truth. When you notice these signals early and respond with intelligent, natural support, your body has an incredible ability to recover, rebalance, and rebuild. And one of the most effective ways to do that is with a specific combination of two natural allies: 100% pure cranberry juice and magnesium. Now let's be clear, we're not talking about sweetened cranberry cocktails or powders with added sugar. We're talking about unsweetened, cold-pressed, organic cranberry juice. This juice contains proanthocyanidins, compounds that prevent bacteria from adhering to the bladder wall, reducing inflammation and supporting overall urinary tract health. When paired with magnesium, especially in a bioavailable form like magnesium glycinate or citrate, you create a powerful synergy. Magnesium calms the bladder muscles, reduces spasms, and supports over 300 biochemical reactions in your body, many of which affect hormone balance, nerve function, and sleep quality. Here's how to do it right. In the early evening, mix half a cup of pure cranberry juice with half a cup of filtered water. Drink it slowly. About an hour before bed, take your magnesium supplement, ideally 200 to 300 ml, unless otherwise guided by your healthcare provider. This simple routine does three things at once. It supports the bladder lining, relaxes the bladder muscles, and prepares your nervous system for deeper sleep. Many people who apply this consistently report fewer nighttime bathroom trips, less urgency during the day, and improved energy levels. But like everything shared in this journey, it works best when combined with the foundational changes you've already embraced: the right hydration rhythm, anti-inflammatory foods, healing herbs, and a body that is supported from the inside out. Frequent urination after 50 isn't a verdict. It's an invitation to listen more closely to your body, to respond with care, to act not out of fear, but out of self-respect. Because when you take the time to learn what your body is trying to say, you no longer chase symptoms. You lead with wisdom. Let this be the beginning of a healthier, more connected version of yourself, one that sleeps better, thinks more clearly, and wakes up feeling whole. If this journey has been valuable for you, consider sharing it with someone you care about. Like or follow if you want more insights like these. And most of all, stay curious. Because your body is always speaking, and now you know how to listen.